Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends that are impacting our industry today. Joining me today is Mike Jones, the president of our payer business unit at Inovalon. This episode is part of a mini-series where we look specifically at 2026 and what our internal thought leaders predict will be top of mind in the healthcare space. Thanks for being here today, Mike.
Thanks for having me, Justine. It's always a pleasure.
So we know the payer landscape was pretty turbulent in 2025. So tell me what your number one piece of advice would be for health plans heading into 2026.
Well, 2025 was turbulent. That's probably an understatement, and that's going to continue in 2026. And we expect the biggest challenge to continue to be the medical cost trend. It's projected to be somewhere between 8.5% and 9% growth, again, year over year. And the biggest drivers of that are the behavioral health services, the pharmacy costs, and hospital inflationary costs. So the strategy that plans are going to focus on is really to invest in predictive analytics platforms that can monitor and analyze those rising cost trends, and then feed into utilization management platforms that can help to bend the cost curve.
So looking at the quality side, how might digital measures influence performance this year?
Well, digital quality measures are going to continue to improve quality measurement in the areas of accuracy and efficiency, and also move towards more real-time measurement. These streamlined workflows are going to benefit plans in several different ways. They're going to reduce the administrative burden and the costs of manually collecting data, as well as allow them to act quicker in response to the needs of their members. I'm very proud that Inovalon and our partners will continue to be dedicated through 2026 to incorporating these digital measures into our converged quality platform and staying ahead of that curve.
And then on the risk side, with RADV audits increasing and accurate documentation more important than ever, what strategies do you recommend for health plans to be audit-ready all year?
So CMS has certainly intensified the scrutiny around RADV audits. And the plans are continuing to move from an episodic prepare and respond mindset to these audits to being more continuously compliant. The strategies around that is really in increasing your provider outreach to improve documentation quality, to implement data quality standards, and to maintain that proactive audit compliance readiness at all times.
And tell me a new payer solution you are most excited to really see make an impact in 2026.
Well, I'll give you two. The first one is Converged Record Review for both quality and risk, and it will impact our plans significantly as they prepare to become more audit compliant at all times. The second one really, as I look at the continued scrutiny around mining retrospectively records for risk adjustable conditions, as well as the high cost of in-home assessments, the industry is going to move towards concurrent coding and really closing the gaps at the point of care. So we've invested heavily in our outreach connector ecosystem, where we can integrate into the various EMRs that our plans providers use and push gaps for both quality and risk directly into the workflow so they can address them at the point of care at the time of the visit. These integrations are going to continue in 2026, and I'm really excited about the expansion of our ecosystem.
Absolutely. Well, this is certainly very exciting stuff, Mike, and will be interesting to see what is to come in 2026.
Thank you.
Appreciate you taking the time to share this insight. And of course, to our audience, thank you for tuning in, and be sure to check out the other episodes of our Trends and Predictions mini-series.